all the way to the end of the lecture. The other one I posted yesterday are this. I actually uploaded 4 samples of the NGN that's going to be on your exit this coming 22nd. And this is one of the example. This is NGN on heart failure. I also uploaded on opioid toxicity, right? Also on tuberculosis. That's another one that's going to be there. And what was the other one I uploaded? It was like narcotic, yeah, that one. And blood transfusion. That's it. That's another one that's going to be there. Blood transfusion NGN. So it already has the answers. I think some of you missed it though. So there are 6 questions on this, just like your actual clinical judgment. If you scroll down, the answers are the one with the asterisk. That's what it is. Alright? So those are the answers right there. And then here are the rationales for the answers. So the same for the second question, which is analyzing cues. The answer is right there, the one with the asterisk, okay? And then you have the rationale on the bottom. So it's this may not be 100% exactly what's going to be on your exit, but it's a really good example that can give you an idea of what are the type of things that comes up on the NGS. Right? Because it's hard to predict, so it's really good that you have as much example as you can on an NGN question. Because man, I think this is probably the longest, the unfolding case study for your test. This is the one that takes a lot of time. So just just to remind you guys, it's good that try to get as much sample as you can and practice on this. Because the way the test works when you take it on the 22nd, it's random. You're not gonna get the same question all at the same time. What will happen is you will have different items in number 1. The usual thing that I worry about are the ones who actually gets the NGN first. Okay, why? Why do I worry about those students? Because you get exhausted early on in the exam, and then because of that, you can't focus anymore on the easier questions towards the end, and you end up missing the ones that are easier that will give you more points. So it's important that if you're not used to this, to make sure that you keep practicing on it already. Try to generate as much practice questions as you can on ChatGPT, or on your API, all of the practice A and B, they have NGN. Practice on as much as you can on the NGN, because if you're not, then like I said, if you're the one who's going to get this at the beginning of your exam, it takes a lot on you, and then towards the end, you're already exhausted. Right? So that's the problem that I usually see, because once your mind is not used to it, you get tired. Towards the end, you can't focus on the easier question anymore, and you'll miss the easier ones. Okay, so practice as much as you can on this one. Okay. Also, each NGN towards the end, I also gave examples of bow-tie questions, because bow-tie questions will also be coming up. So you also have bow-tie questions, okay, like this one. So bow-tie questions are the ones that are like drag and drop questions. And the way it works is that you want to make sure you figure out the center first, because everything else on the side will depend on the center. So if you're not able to get the center right, then all of your answers on the side will be wrong as well. Right? Unless you get lucky and you guess a good one on the side, and you might get one. But remember, this one is a partial points. So it's an advantage if you actually get more answers right, because you'll probably get some points there. But if you get more answers wrong, then you get a 0. Okay, so let's say, for example, you get 3 answers right, you get 2 wrong, well, at least you still end up with 1. Okay, it's still better than nothing. Rather than before, it's an all or nothing thing. You miss one and you're done. Okay, but now because of the NGN, even your NCLEX, your boards exam, it's like that. It's all partial points. The ones that you got right, they'll deduct the ones that you got wrong, and that's the point you'll get. Right? Okay, so here's an example of the bow tie. Like I said, this one, the way it works, figure out the center, then figure out the sides. Because that's how it works. As long as you get the center, then it's easier to find the answer for the sides. Okay, we'll discuss this more when we go to med-surg, because the focus of your NGN is really med-surg and mental health. That's really the main focus, med-surg and mental health. So that's why yesterday when I gave you the list, you're all med-surg or mental health, especially psychosis, right? And you will see also my examples, the one that I uploaded, are med-surg, tuberculosis, heart failure, opiate toxicity, and blood pressure. Alright, be clear on this one, guys? Any question? No? Alright. Then we will continue with our lecture. Okay, so yesterday we finished in a section where we discuss referrals, right? Referrals. There you go. So this one, as I mentioned, it's not going to be such a bad one on our exit. So it's an easy one as long as you remember which member of the healthcare team is responsible for specific functions that they'll be asking. Like yesterday, my example was on medication. You can't read the prescription, but you don't have an option to pick a doctor, right? Then what would be the next best thing from a doctor to correct the prescription? I said nurse practitioner, right? Or PA. Okay, so those are the next best answer. Not a pharmacist though, okay? Because a lot of times that's where some students gets it wrong because they will pick pharmacists. But remember, pharmacists cannot write prescriptions. They can only give recommendation. They can tell the doctor this might be a better idea. They can tell the nurse this might be a good idea, but they cannot write prescriptions. The only ones who can write prescriptions are doctors, nurse practitioners, and PAs, right? Alright? So don't forget that. Okay, so just memorize, remember their responsibility, what are the things that they can do, and that's how this thing is going to be asked. Okay? Now the next one, there are, I think, 2 or 3 questions related to this that's going to be on our exit. This is also under the legality and ethics of nursing. This is what we call advanced directives. Okay, now, one thing you have to remember is a lot of times people get confused. They think advanced directives, living will, and durable power of attorney are different things. Right? They're not. Because living will and durable power of attorney are the 2 types of advanced directives. So I want to make sure that that's clear with everyone, that when you talk about advanced directives, that there's actually 2 types, okay? So when you talk about advanced directives, this is your living will and your DPOA. Right? Because sometimes people think that living will is different from advanced directives. No, living will is a type of advanced directive. DPOA is a type of advanced directive. Right? The difference though is that a living will is a documentation of what the patient wants. Right? What the patient wants. Do I want CPR? Do I want to go to the hospital? Do I want NG tube? Do I want tube feeding? Do I want IE antibiotics? This is what I want to do if in the case I become incapacitated. That's where it's all written in the living will. So that's a paper. That's a documentation. The DPOA, this one is a person. This is not a documentation, right? This one is an actual person. It's an actual person that who actually assigns it. The patient. Mm-hmm. The patient will pick one, whether the patient wants to pick their spouse, their children, their neighbor, their gardener, their mailman. It's really up to them. They can pick anyone. They can pick anyone as their DPOA. The thing though is the DPOA, once the patient picks it, then this person has the responsibility of what? Representing the patient. The DPOA becomes the actual representation of the patient. Okay, now, always remember, the advance directive doesn't really become active not until the patient becomes incapacitated. Yeah, as long as the patient has the capacity, then there's no need for the advance directive to kick in. They can have it, but it's not going to be active not until they become what? Incapacitated. Alright, now, in the event that the patient has both, they both have a living will and a DPOA. The patient made two, right? The patient wanted, I have a living will and at the same time I have a DPOA. In the event that the patient becomes incapacitated, then the responsibility of the DPOA is to make sure that the living will is what? Is followed. Okay? The DPOA cannot make changes to the living will, even though they are the representative of the patient. Because by law, it is only the patient that can make changes on their living will. No one else, okay? No one else can make changes on their living will except the patient. Even though they have a what? A DPOA. The responsibility of the DPOA is to carry out the living will. Now the question is, in the event that the patient doesn't have a living will, then who will make the decision? The DPOA. Okay, so there's no living will at all. The patient just assigned or, pretty much picked a DPOA. Then in that event, because there's no living will to follow, that DPOA will be the one that will make decision for the patient. Whether the DPOA wants CPR, or the DPOA doesn't want CPR, or the DPOA wants the patient to be taken to the hospital, it's up to the DPOA. And if it's the DPOA that gets all the patients what? Information first. Alright? Not the family, not the son, not the spouse, depending, of course, who is the actual what? DPOA. Okay? Is that clear, guys? So don't forget that. That's very important for when it comes to advanced directives. The other thing, before we go back to the question, the other thing that they will ask you about advanced directives is when it comes to advanced directives, where does it actually apply? Always remember this, it doesn't only apply for end-of-life care. It can apply for anything. Okay, because a lot of times, one of the things that the student misses is they think that it's only for end-of-life. Incapacitated doesn't mean what? End-of-life. If someone, let's say for example, develops a stroke, they cannot think, they're not end-of-life, right? They're still alive. But the advanced directive can kick in. Right? So it can apply in situations that the patient becomes incapacitated, meaning cannot think anymore. Right? That's what it is. So don't pick an answer that says what? Is only applicable for end-of-life care, because it's not. Right? Now if it says it can be used for end-of-life care, then that's the right answer. Right? What made the first one wrong? Because I had the word only. So remember, don't pick the options that have the words all, never, always, all the time, right? Because there are exemptions to the rules. Okay? Alright, so don't forget that. The other thing that they will ask you on advanced directives, the other version of this, because like you said, we have two versions of the exit. The other version is they might ask you the responsibility of the nurse. What is the responsibility of the nurse when it comes to advanced directives? Okay, so there are three responsibilities of the nurse. The first responsibility is to check if the patient has an advanced directive when they come in. Upon admission, the nurse would check if the patient has an advanced directive. Okay? Right? Now, if the patient doesn't, then the nurse can act, the second responsibility of the nurse is to what? To inform the patient about what is an advance directive. Okay, to inform the patient about what is an advance directive. Okay, and then the third responsibility of the nurse is to guide the patient on who can help the patient create the what? The advance directive. Okay, so check, alright, explain, and guide who can help the patient in creating the advance directive. Those are the three responsibilities of the nurse. Now the question is, which member of the healthcare team actually helps the patient create an advance directive? The social worker. Very good. Okay. The social worker. Correct. That's the member of the healthcare team. The social worker. Okay. It's the social worker that helps with the creation of an advance directive. And always remember, advance directive, they don't expire. That's another one that I want to make sure that you guys are aware, because that's a question actually. You know, one of the options is that it expires. No, it doesn't. Even though it's been 10 years, 5 years, 10 years, it doesn't expire. It can be modified though. What does modified mean? Make changes. But who can make the changes?
Patient.
Patients. Okay. Patients. Alright, you clear with that one?
Mm-hmm.
Alright, very good. So let's go ahead and answer this, and then we'll figure out some stuff. Hey! Alright, so yes, so the nurse is reinforcing teaching about advanced directives with a client that has end-stage renal disease. Which statement by the client indicates an understanding of the teaching? You are correct. Letter A. I should discuss this document with my family after I sign it. Here's the thing. Why is it after? Why not before? Why not during, right? Correct. So one is so that there is actually no influence on the decision that the patient will make. It's entirely what? Their decision. Nothing is influencing them from thinking about it. Okay. The other one is, when it comes to advanced directives, family members of the healthcare team, nurses, doctors, cannot be witnesses to an advanced directive. Alright, that's different from an informed consent. Because a lot of times, you know, for informed consent, who's the usual witness? The nurse, right? The nurse. Yeah, the nurse are the usual witness. But for an advanced directive, the nurse cannot be a witness, the doctor cannot be a witness, the family member cannot be a witness. Who can actually be a witness? A stranger. Has to be a stranger. No, that someone that doesn't know the patient. A stranger. So someone walking by the hallway, you can pick out that guy. That can be the witness. Someone that doesn't know the patient. Okay, so that's very important. That's why that is the right answer. B, why is B wrong? You don't need an attorney. Who actually does it with the patient? Social worker. The attorney can be involved, a lawyer can be involved, but you don't need them to create one. You don't need them to create one. You only need what? The patient and the social worker and the witness. Alright, question. There's a question on your exam. If the patient is a non-speaking, English-speaking individual, what is the best way to interpret or communicate? Can we use the family member? No. Can we use a member of the healthcare team that speaks the same language?
No.
That can be an answer, but not the best one. The answer is interpreter. Correct. So make sure you look for that word, interpreter. An actual interpreter. Okay, now, if the interpreter is not there, then your next best answer is a member of the healthcare team that what?
Speaks the same language.
The Why isn't only the second option? Because remember, healthcare teams are not supposed to be what? Witnesses. You can't be there, right? You can't be there to do advanced direction. So again, the best way is an interpreter. Okay, that's not related to who? To nursing and to doctors. Okay, someone that can actually interpret. How about, again, not a family member, okay? Don't pick a family member. Alright, very good. My partners need to be present. We all know they can. I am not allowed to change. Yes, they can change it. As long as what? They have the capacity to change it. And it's only the patient that can make the changes. Alright, next one. The nurses can for a client who is unconscious and has a living will. The client's family asks if they can make changes to the life-saving measures now that the client is unconscious. Which of the following statements should the nurse make?
D.
Can they make changes?
No.
No, right? Because the only one that can make changes is the
Patient.
patient. So the answer is the living will states the client's wishes regarding their life-saving
Measures.
That's what it is. No one else can make changes unless, right, the patient doesn't have a living will. Then who can actually make decisions?
Yeah.
PPOA.
PPOA.
Don't forget, on your exam, PPOA are sometimes called health
Proxies.
proxy. Okay, so when you see the term health proxy, that also means DPOA. Okay. Alright, so here's the next one. The nurse is reinforcing teaching about advanced directives with a client admitted to the hospital and scheduled for surgery. Which of the following statements made by the client indicates a need for further teaching? We're looking for something that is said what? Wrong, right?
D.
Something that was said wrong is letter
D.
D. Correct. My children can make changes to my living will. They cannot. Only the patients. Okay, so please don't forget that. Everything that I talked about is actually explained on this page. So don't forget about your two advanced directives. Okay, living will and durable power of attorney. Again, if the question on where is an advanced directive can be used, don't forget, it can be used for anything. And not only for what? For end of life care. As long as the patient becomes incapacitated, even though they're not dying, but they cannot think, right? Then the advanced directives will give. Okay. Alright? Very good. Okay. Alright, really quick. This one is just one question, but I just want to discuss it really quick. A nurse is working on a unit and suspects a co-worker is chemically impaired.
Charge nurse.
You have someone coming in, drunk, or like taking some narcotics. Which of the following members of the chain of command should the nurse notify first?
Charge nurse.
The charge nurse. So the other reason why I mentioned this is because if this question ever comes up, do not approach the coworker. The best thing to do is what?
Charge
Report.
nurse. Yes.
Alright? So also on the question about abuse, for any patient suspected of abuse and you've already done your assessment, what do?
Report.
Reports. Okay, we're all mandated reporter, whether it's a case of abuse, whether it's a case of chemically impaired coworker, we have to what? Report. Do not what? Do not engage. We do not approach them because that will cause a problem. Alright, one more thing before I forget, something related to this. Active shooter. They're going to ask you about active shooter question. Alright, so just remember this. In the case that there is an active shooter situation, the very first thing you want to do, because that's what something that they may ask you, is to turn off your cell phone. Yes, turn off your cell phone. Okay. Why? Why do you think turning off your cell phone is the first thing you want to do?
Sound.
So that what?
Because he can't find you.
It's off because if it's silent, it might vibrate. You'll still hear you vibrating.
Yeah.
Right? So the best thing is if they ask you what's the first thing to do, turn it off so that you can make decision whether you what? You want to hide, you
Or
can
fight.
make a report and wait for help, right? Because when that vibrates or rings, guess what? You're done. Alright? Yeah. You're a moving target. So it is. So doing that, you'll be able to hide and think of the necessary steps to do. Even lock yourself and they won't find you. Okay? That clear, guys? So do not approach the active shooter, okay? Best thing to do is hide yourself. Alright? So turn off the cell phone. Okay? Alright, guys. Very good. Here's another example. A staff nurse suspects that a newly licensed nurse is chemically impaired. Which of the following actions should the staff nurse take? Letter A. Yes. Right. Yes. Don't talk to the newly licensed nurse. Okay. Notify the charge
Bless you.
of the situation. Alright, there you go. Okay. Alright, very good. Next one. Very important. Just memorize it. They're gonna ask you a question on reportable diseases. Reportable diseases. So all you need to do is just memorize the things on the list. Reportable means like if that patient has something contagious, are you responsible for reporting it to the health department, the state, and the CDC? So it is, okay? So don't forget, reportable diseases. It's right there already. Just remember the examples, okay? Reportable diseases.
Syphilis. Diphtheria.
Yeah. Anthrax. Majority of these things are really more of sexually transmitted disease, hepatitis, tuberculosis. Oh, I forgot one thing here. Scabies. Yeah, scabies. Just imagine if those things fly, right?
Particles.
Good thing they don't. And if they had wings, you'll be done. Alright, any questions on the reportable diseases? No, alright, next. Informed consent. Alright, here we go. The nurse is caring for a client and wants to verify if an informed consent was discussed by the MD. So it's something that you want to verify if there's an actual informed consent. One statement by the client verifies an informed consent was actually made.
B? Is that A or B?
So by our test taking strategy, we can already eliminate C, right? So no one's gonna pick C, right? Right. You thought about it. It's gonna be C, right? Okay, no C. So we're left with A, B, and I cannot change my mind. Well done. No D also, right? So we're only left with A and B. The right answer is D.
B.
That's the right answer. Okay, why?
So you have to know
knowing
the.
when the surgery is gonna happen, that's a general knowledge. Plus, you see this tomorrow, it's not specific. It doesn't say what?
The kind and yeah.
Tell you. It says tomorrow. Everyone knows that, right? But when it comes to advanced directive, it's important that you know the detail. What kind of detail? The benefits, the risks. Who is your surgeon? Who is your anesthesiologist? Who is going to be something that will follow up on your care? Right? The other things, the other alternative to the treatment. See this? It says, this is my only option. That's wrong. Why? Because there should be what? Alternatives. Alternatives. Okay, so alternatives to the treatment is also important to be part of the informed consent. Now the question, who actually completes the informed consent with the patient? It's the doctor. Who actually checks and witnesses it? The nurse. Okay? So if the patient has questions about the procedure, what will the nurse do? Call the doctor, let the doctor know so that the doctor can come back and explain it to the patient. Now simple things you can answer as a nurse. But if it's something related to the procedure, who do you want to answer it? The doctor. Okay? Because it is the doctor that will complete it with the patient. It is the nurse that will witness and make sure that it has been completed. Okay? Alright, here we go. So the physician is preparing to obtain a consent from a client as a tibial fracture. The client receives IV morphine sulfate prior to the arrival on the unit and scheduled for surgery. Which of the following actions should the nurse take?
Delay.
This is a little bit confusing, but I'll explain it to you guys. Yeah, I think it's just poorly written. I should have just removed this. Anyway, we'll just answer. It's poorly written though, the question. But then things the answer though.
Delay?
So, when we answer this, there are very important details here, right? We need an informed consent, but at the same time though, your patient took IV morphine, right? So that's a problem because any patient who has taken narcotics, or anti-anxiety medication, right, cannot sign informed consent, right? Because they're what? They're altered.
Yeah.
So they cannot sign it. So in that event, what would be the next step? Right? So it's either that B definitely would be wrong, right? Because you can't just say, oh well, you're already impaired, so I'll just make sure that you sign it, right? Alright, that's not okay. Alright.
C is wrong as
The other
well.
one is C, obtain the consent from the client. Well, that would be wrong, right? Because we said that if they're altered, they cannot what? They
Can't
cannot
give
sign.
consent.
Basically, B and C is actually what? The same. They're the same. You want to get the consent from someone who's altered, but you can't. That's not legal, right? That's illegal. Okay? So you can only go for A or D. Okay, why did I say that it is poorly written? It's poorly written because the relative was not very specific, but that's actually the right answer.
Really?
Yeah.
Why?
You can actually obtain consent. And if you can't find anyone related to the patient, who will make the decision?
Doctor?
The doctor, right? They'll get an emergency order from the court that the doctor can make the what? The decision. Now, this would have been okay also, thinking that the procedure is not really what? An emergency.
C.
Because it's only a what? A
Tibia
tibial fracture. So that's why I said it's poorly written.
That's what I was
But I
thinking.
just want to make sure you guys are aware that if the patient cannot sign, then who can give the consent?
Relative?
Relatives.
Okay.
Relatives. And the last option would be the what? The physician. As long as the physician gets the court decision.
That's
No, they can actually anyone that they can find. The fastest relative could be, like son, daughter, wife, right, spouse. Yes, very good. That's a good question. What is the difference? Because there's actually a question on our exit, and they're going to ask you which procedure requires uninformed consent. So don't forget that, okay? Now, I'm gonna answer that question first. What is an implied consent? Implied consent is when you say, yes, do it, without signing a what? A document. Let me give you an example of an implied consent. The doctor ordered for you a Foley catheter so that you can actually be able to urinate because of your large prostate, right? So in that situation, the patient said, yes, go ahead and insert the Foley catheter. What is that?
Informed
That's an
consent.
implied.
Oh, right.
That's an implied because you said what? You just said yes to the procedure without actually signing a document.
Oh.
So, what are examples of things that requires an informed consent? Foley catheter, that's wrong. Don't pick that. That doesn't require an informed consent. How about an insertion of an NGT? Does it
No.
require an informed consent?
No.
NGT? No.
No.
That's also implied consent. Okay, so that would be wrong. Okay? How about bladder scanning?
No.
No, right? That's also implied. How about giving a medication?
No.
Just imagine, each time you give a medication, they will sign the document and say, yes, you can give me the medicine. Man, that's gonna take a long time. Oh, man. Alright, so that's also what? An implied
Implied consent.
consent. Yes, you can give me the medication, right? So what are examples that requires consent?
Amniocentesis.
CT scan. The CT scan require an informed consent.
No. Is it the contrast
Alright,
there?
here's the thing. CT scan or CT scan with contrast. Which one requires an informed consent?
The one with contrast.
So be careful. It has to say with contrast. It has to say that. It has to say it. If it doesn't say that, then that means you're only saying CT scan, and that doesn't require an informed consent. Things that can cause possible harm will require informed consent. Contrast, anesthesia is another one that will require informed consent. Surgical procedures will also require what? An informed consent. Biopsy, because that's what? That's also a minor surgical procedure. Biopsy is another example that would require an informed consent. Another one is, the treadmill stress test, where you have to be on a treadmill and you have to run. That also requires an informed consent. Why? That can actually result to an MI or a heart attack. Okay? So that also requires an informed consent. Is that clear, guys?
Yes.
I have a question that was like, like a minor came in with emergency, and straight to surgery.
Oh yeah.
Maybe that was probably an error question. Because surgery, when you say implied, is just you just say it. You can't go to surgery with just saying it.
Well, if it's pathetic, no, it was. I think it was. I remember the question, but she was like a doctor being pregnant.
What was it? Do you have the copy? Next time you guys see it, take a picture of it so we can see. Because sometimes, there might be a detail there that's different to how it was said. You need to get sure the details, okay? But if you see it again, bring it here so that we can, take a look at it. Okay, guys?
Ano ba sinabi niyo sa, sa informed consent?
But then someone
Surgery,
could have
contrast
given
dye, stress
consent.
test, tsaka ano?
That should be what? Probably the physician.
Biopsy. Oh, biopsy.
Yeah, it said wait for something to start moving.
I want to see the question so I know specifically how it works. Next time you see one, take a picture so we can see. Because sometimes when you say we miss some detail, and then I end up explaining it the wrong way. Okay, so yeah, let's not miss any detail. Okay, right. I'll try to take a look at it and we'll see. Okay. All right, let's take a look. Here's another example. The nurse is checking an informed consent from a client who is scheduled for a total hip arthroplasty. So that's hip surgery. Which of the following statements should the nurse include?
A.
The answer is
A.
letter A. Your provider will discuss other treatment
Options.
Very good. Okay. Your partner will need to witness you sign the consent. No need, right? You can also be who? The nurse.
The nurse.
The charge nurse will review the risk. No. Who
No.
reviews the risk?
Provider.
Doctor. Once you sign, that's it. You sign your life away. No.
No.
You can refuse. Okay. So just remember these things here. The other thing they will be asking you is this, and this will come up definitely on our exit, is who can sign? Alright, who can sign? Don't forget that. Who are considered adults that can sign the informed consents? Right, so it's right here, parents of minors, legal guardians, court-specified representatives, okay? Individuals that are DPOA, emancipated minors, minors that are, deemed adults by the court. Also, minors, but they're pregnant, right? So the pregnant minors can also make their own decision on in regards to their health condition. And minors that are member of the military can also make decisions. Don't forget, guys, okay, it's right there. They're gonna ask that. And then the other thing that they might ask is the responsibility. It's all here, it's already highlighted. What the doctor should be doing and what the nurse should be doing when it comes to informed consent. Okay? Alright guys, any question on this? Any question at all? No? Alright. So next one, really quick, also memorization. They're gonna ask you what to include in a change of shift report. What to include in a change of shift report. Alright, so a few things that it's important here. You want to make sure that the things or information that's on the change of shift is something that is significant. So, let me give you an example. Let me know if this should be included in your change of shift report. The patient wants to have a shower at 10 a.m. in the morning.
Yeah.
Should that be in your change of shift report? No. Right? Don't have to. You can actually inform them in general, but it's not an important part of the what? Change of shift. Alright? So, the next one. The patient had their pain medication at 4 a.m.
Yes.
Yes. Very good. Okay, why? That is part of the change of shift. You tell them when was the last pain medication was given. Okay? That's important. The patient has a dental appointment by noontime.
Yes.
Yes, appointments are also part of the change of shift reports. Okay. Patient Watson was discharged at 7 a.m. Yes or no? Patient Watson was discharged at 7 a.m.
Yes.
Yes. Why? Discharge, new admission, part of the change of shift report. Okay. Discharge, new admission, part of the change of shift reports. Okay. Is that clear, guys? Okay. The next one. Patient Watson again at 6 a.m. has a blood sugar of 55.
Yes.
Yes. What is that? A COC.
Change of condition.
COCs are also what? Considered part of the change of shift reports. Okay, so please remember those things. Discontinued medication or new medication. Yes, also part of the change of ship reports. Okay, discontinued medication and new medication is also part of the change of ship reports. Okay, all right, guys, very important to know. Okay. Alright, be clear? That one? Alright, very good, very good. Okay, we'll go on a short break, guys. We will be back by, 10:00. Example earlier, when we were discussing about implied consent, wherein you have a situation
Oh,
that
conscious
you
patient.
don't need to sign a document. So I found that something very similar to it, which explains another side of implied consent. Let's go ahead and read this. During an emergency situation, a nurse is about to administer a life-saving treatment to an unconscious patient. What is the most appropriate justification for proceeding without obtaining explicit or informed consent? So the answer is that patient is unavailable. The answer is implied consent is assumed in and cases of
Emergency.
So that's the key. So that's what I want you guys to remember. That's the other application of implied consent. If they're not able to verbalize, if they're not able to sign, the other meaning behind implied is the answer is yes, even if they're silent, because what? It is an emergency. There you go. There you go, guys, okay? Emergency situation, that's another application of implied consent, meaning that the answer is yes, even though without a response. Okay? So emergency situation, right? Wherein it's life-saving. There's no way, in order for the patient to survive, that needs to be done immediately, implied consent. In that situation, though, even though it's not really on the question, the physician actually signs, that the procedure is needed really by the patients. But again, it is for the purpose of emergencies. Okay? Alright, now next. Isolation precaution. So really quick, I just want to do a quick review on hand washing because they're going to ask you about hand washing. Alright? So a few things to remember when it comes to the steps of hand washing. What do you do first? You wet the hand first. Right? So take note. The very first step into hand washing is you wet the hand first. After you wet the hand, what's the next step? Step number 2.
Soap.
Put the soap. Right? Put the soap and make sure that the hands are below the levels of the elbow. Okay, it has to be below the levels of the elbow. Why should it be below the elbows of the elbow? You don't want it to drip, right? You don't want any drip. You want it to, anything that you're washing off, you just drop and not go into your skin, right? Okay. So, other than that, vigorous scrubbing.
Yep.
Interlocking your fingers. Okay, you can also clean on your, of course, nails, but you do it for a period of 10 to 15 seconds under running water. Now, where's the other 5 seconds? Drying. So that's why the total time for washing the hands is what? 20 seconds. So 10 seconds of scrubbing, cleaning, interlocking, 10 to 15 seconds, and then 5 seconds of drying. Now the question is, which part of the hand do we dry first? Ask that. The fingertips. Right. So you start from the fingertips. This is what you dry first. You go to the palms of the hand. You go to the back of the hand, and then you go where?
The wrist.
Right? And if you need to go back to the fingertips, you need to use a different paper towel. Okay? So clean the dry the fingertips first, then the palms of the hand, then the back of the hand, and then last is the wrist. Okay? And again, this is the best way to prevent infection. This is the best way when it comes to infection control. Especially when the hand is what? Visibly soiled. Alright, now sanitizers are options as long as the hand is not soiled. And you can only use sanitizers between two patients, but the patient should not have isolation precaution. If they have an isolation precaution, you cannot use hand sanitizer. For patients that are on isolation precaution, it's always best to what? Use hand sanitizers. Okay, use hand sanitizers. Okay, now, the next thing, what are the different type of isolation precaution? Contacts, right? What else? Droplets, right? Droplet. And then what else?
Airborne.
Airborne. Okay, now, there are actually two special isolation precautions, which is, you have two special ones. Which is the neutropenic and the
Protective isolation.
precaution. Okay, so neutropenic precaution are primarily for patients that are what? What is the type of patient you put in a neutropenic precaution?
Yeah, they're neutropenic.
Immunocompromised. Okay. Or what is the other term? Neutropenic or agranulocytosis. Right, so immunocompromised. Okay. So meaning that they don't have an intact immune system. They are at risk for infection. Now, what is the other name for neutropenic precaution? Because this also comes out of your exit. The other name is positive pressure
Oh, that's what that is?
room. Which one is the one that's negative pressure? Who do you put on negative?
Airborne.
Airborne. Right? Those who have airborne precaution goes into negative pressure. Those who have immunosuppression or immunocompromise, right? Or they're neutropenic or they're agranulocytosis, you put them in a positive pressure room. So what are examples of negative pressure? MTB. Don't forget that, okay?
Measles.
MTB.
TB and varicella.
Measles, tuberculosis,
Varicella.
varicella. Now remember though, shingles, because shingles originated from varicella, is also part of airborne. Okay? So MTB. Measles, tuberculosis, varicella. So again, when you say airborne, what kind of room? Negative pressure room. When you say neutropenic precaution, positive pressure room. So don't forget this one right here. What type of patient do you put in? Immunocompromised. You're gonna ask that, okay? What type of patient do you put in? Someone who is immunocompromised. Okay, one more thing, because we're already discussing immunocompromised. They're gonna ask you, what is a condition which immunization is contraindicated? The answer also is what? Immunocompromised. So between someone who has a high fever and someone who is positive for AIDS, which one is the one that's that should not get the immunization?
AIDS?
Yes, someone who's immunocompromised. Okay? Someone who's immunocompromised should not get it because they don't have an intact immune system. So that means that immunization is not going to be healthy for them. Immunization is not going to be healthy for them because your immune system cannot react to it. Okay? So take note of that. Very important to know. Being sick, when you have fever, that means you have a healthy immune system. Because fever is actually a what? It's a defense mechanism. You guys know that fever is not bad, it's actually good.
It's trying to kill the
It's a
bacteria.
defense mechanism. The only time fever becomes bad is if the temperature is what?
Too high, cooks your brain.
Okay, so with that said, when we're gonna talk about neutropenia in a little bit, the plan of care, don't forget the different types of PPE, especially the sequence. They might ask you the sequence of putting it on and taking it off. Don't forget the term donning means put on. The term doffing means
Take off.
When you put on your PPE, the first thing you put on, gown, mask, goggles, and then gloves. When you remove it, you remove the gloves first, followed by the goggles, followed by the gown, and lastly, mask. Okay? If you think about it, removing the PPE, it's alphabetical.
Mm-hmm.
It's alphabetical. G-L, G-O, G-O-W, M. Alphabetical. Alphabetical order, okay? So don't forget, what comes up first? The gloves. Why? The gloves is the dirtiest part of your PPE. Okay? It has to come up first. And then of course the mask comes up last because you want to protect your what? You want to protect your what?
Nice.
Airway.
Oh.
Okay. So that's why it comes up what? Last.
Yes.
You have to protect your airway. Okay? Is that clear, guys?
Oh.
Alright, now, here's the thing. The question sometimes becomes, tricky, especially when they ask you what to wear. Alright, so let's say, for example, it's not gonna be select all and apply, okay? It's not gonna be select all and apply. The situation is, you have a patient with MRSA of the womb. Here's the thing. These are the PPEs. You can't pick all of them. You will only pick one. Which PPE will you pick to wear on an MRSA of the womb? Which one? Who says gloves? Who says goggles?
So you can only do
Who
one.
says gown? Who says mask? And there's a lot of you who are like, man, it's Sunday.
It's one or the other.
Alright, so don't forget. Very important to know. Before we answer that, what kind of isolation precaution is this?
Contact.
What does this fall under? Fall
Contact.
under contact. Very good. Any type of isolation precaution when it comes to contact, the best PPE is
Gloves.
the gloves. Glove is the best one. Why? It is your hand that what? Touches the patient. Okay? Although your body might come in contact, but you don't use your body, right? You touch the patient. What do you use?
Gloves.
So, if it's not a select all that apply, what are you gonna pick?
Gloves.
The gloves. If it's select all that apply, what would you pick?
Gloves and the gown.
Gown. Okay? The gloves and the gown. Alright? Now, if it says
Irrigation. Then the
of
goggles.
the MRSA of the womb, what PPE are you gonna wear?
Goggles.
Select all that apply.
You add the
Everything.
goggles. Yeah.
Why is it everything? Because there's a risk of
Splash.
splashing. Okay, splashing risk. So in this situation, we're gonna irrigate. There's a splashing risk. What are you gonna wear? You're gonna wear everything: glove, gown, goggles, mask. Okay. Now, the opposite. The situation now is varicella. Alright, varicella.
Airborne. N95.
So, what PPE? Just one. which one is the most important thing you're gonna wear?
Mask.
The mask. Very good. Because it's airborne. Airborne and droplet, like let's say pneumonia, right? Or MRSA of the sputum, it's in the sputum. What PP is the most important thing to wear? Mask. Because it is droplet or airborne. Droplet or airborne, you have to wear the mask. But of course, for airborne, we all know it's a special mask, right?
N95.
What type of mask?
Yeah, 95 for airborne.
N95. Alright, now, there was another precaution that I wrote down. I wrote down protection precaution. Protection precaution is the type of precaution for patient that does not have enough platelets, meaning they are at risk for what?
Bleeding.
Bleeding and injury. Okay, bleeding and injury. Okay, so we're gonna go and talk about neutropenia first, or what do we call this?
Immunocompromised.
Neutropenia. They are placed in a positive
Air pressure.
pressure room, right? Alright, give me some plan of care. What are the things that we need to know or to do for this patient?
Okay. No fresh fruits or
No
vegetables.
fresh flowers, no fresh
Fruits are, yeah.
all the food should be cooked, right? No flowers.
Only 50 people out.
Number 2,
Restrict the
food
number.
be fully cooked. Right, what else? Do we restrict or do we limit visitors?
Limit visitors to healthy
Limit.
individuals.
Don't
Yeah.
take the word restrict. Why? No matter what the patient's condition, they're always entitled to what? Visitors.
Visitation.
As long as we minimize the number of people going in and out. Okay? So we don't restrict. What do we do?
Limit.
Okay? Limit. So limit visitors.
Ooh.
Very good. Everything should be sealed. Bottled water. Very good.
Bleach oil and meat together.
What else? Can we have visitors that are coughing?
No. Healthy
sick
visitors, yeah.
Right? Dedicated equipment. Very good. What does that mean? They should have their own blood pressure cuff, manometer, thermometer, right? Okay. Also, they cannot take dairy. They have to avoid dairy. Dairy products can actually encourage bacteria to grow. So avoid dairy products.
Okay. Gotta remember that one.
And when they eat the food should also be sealed. Okay, so sealed food. And all of the food should be consumed, fully cooked, right? But it should be consumed within 15 minutes. You cannot what? You cannot, take it back, seal it again and put it in the fridge. You can't do that. If they can't finish it, what do you do with the rest of the food?
Throw it out.
Throw it away.
Eat it.
Okay. Yeah, you can eat it if you want to. Don't do it. Are we good? Do we know neutropenic now?
Yes.
Alright, remember this, right? We won't forget, okay? Alright. Next one. We're gonna go with the type of another special type of isolation, which is thrombocytopenia.
It's protective precaution.
Or what we call as protection precaution. Alright, so give me some plan of care. No contact sports, correct?
No contacts. Yeah, that one. Electric, yeah.
Very good. Number 2, electric
Electric rings.
Soft toothbrush. Alright, so when it comes to dental hygiene, what is something that they should avoid?
Floss.
Avoid flossing. Very good. Avoid flossing. Okay, so no dental flossing. Avoid contact sports, electric razors, soft toothbrush. Anything else? Anything else? Padded side rails.
Oh, there
padded
you go.
floor. Okay, padded side rails. Padded floor. Okay. Monitor them for bleeding, right?
Monitor for bleeding.
Okay. Monitor them for bleeding. And yes, you have to apply pressure to any injection site longer, right? But here's the other thing that you will ask. What type of medication administration route should be avoided for this patient? What is it? IM. Very good. So avoid IM.
Medication routes.
Okay? Clear with that one? Alright, very good. Okay. And of course, very important to know what kind of food would we encourage for this patient.
Iron rich.
Green leafy vegetables rich in vitamin
Okay.
A. Okay, paito na tayo. Okay, rich in vitamin A. Wanna make sure that's what we do in this situation. Okay?
Rich and vitamin K.
Alright, very good. Any question on neutropenic thrombocytopenia? Alright, so last but not the least, and then we'll actually take the exam. Okay?
I'm so drowsy.
Yes, I want to teach you guys really quick about your ABG. So when we start talking about med surg, you already know how to interpret your ABGs, okay? So ABG, what does ABG stand for?
Arterial blood gases.
This is a little bit things that I have to write. Arterial
Blood gases.
blood gas. Arterial blood gas. Right? So very important when it comes to ABG, you need to know three things. pH, CO2, HCO3 or bicarb. Right? What's the normal blood pH?
7.35 to 7.45.
What?
35 to 45.
7.35 to 7.45. Okay. Interpretation. Greater than 7.45, what is it?
Alcohol.
Less than 7.35?
Acidosis.
Acidosis. Alright. Normal range of CO2.
35 to
35 to
45.
45. Greater than 45? Acidosis. Very good. Less than 35? Alkalosis. And then bicarb. What's the normal? 1, 2, 8. Greater than alkalosis. Less than, it's gonna become what?
Acidosis.
Acidosis. Alright. Remember the value, don't forget, okay? This is, sometimes they might write the value It's just up to you to interpret it, but sometimes they might not, and they might just give you what is the lab result, and it's up to you to interpret that. Okay. Now here's the thing. Does everyone here know the process of Rome?
Yeah. Respiratory
Who
opposite
knows? How about the rest of the class?
metabolic equal.
Alright. Correct. So Rome stands for respiratory opposite metabolic equal. Okay, now I'm going to tell you where does that come in. How do you determine that? Okay, now before we do that, the other thing that I also want you guys to know is the secret behind answering ABG question. Half of the answer comes from where? The pH.
pH.
As long as you remember the pH, you can eliminate option and you will already know what? Half of the answer. Because as long as the pH is greater than 7.45, you know that you should pick what? Alkalosis. And as long as the pH is less than 7.35, you know you're gonna pick what?
Acidosis.
Acidosis. Alright, so here we go. I want you guys to answer this. Here's my question. You tell me what this is.
Irrelevant. I know that's CO2. Okay, so
This is the result of the patient's lab. Based on this finding, the nurse can conclude that the patient has what?
metabolic alkalosis. Alkalosis. Because they're equal. They're
Alright,
both higher.
so first off, I said that look at the pH because it will already give you what? Half of the answer, right? So we're only gonna pick an option that says what?
Alkalosis.
Alkalosis. So we already know that, right? So the next thing, I'm gonna ask you, who says it's respiratory? Who says it's metabolic? How about the rest? There's a lot of it. Yeah, everyone else is neutral, right? Okay, so here's the key. Here's the key. We're gonna go back where? Rome. This is what you do. I'm gonna tell you. It's gonna make it so easy for you when you take the boards exam and the exit. Okay? It's gonna make it so easy for you. This is what you do. You look at the value and then you draw arrows. Okay? So first thing, 7.5. Up or down? 46. Up or down? 35. Up or down? Alright, so here's the rule. If all of the arrows are pointing all up or all down,
It's metabolic.
it's automatic metabolic. Alright, that's the rule. If all of the arrows are pointing up or pointing down, it's automatic what?
Metabolic.
Metabolic, because that's what it says here. Metabolic, all the arrows are equal, the same. Is that clear? Yes or no?
Yes.
Alright, so what if I change this and I put, well, this,
It's still metabolic.
it's what? What is it?
That's still metabolic.
It's
Still metabolic.
Metabolic alkalosis. Why? This one doesn't even have any what? Any arrows. This is
Yeah,
what?
this is just equal.
Normal. But all the arrows are still pointing at the same
Yeah.
direction. So it's still what?
Metabolic.
Metabolic. Is that clear? Yes?
Yes.
Alright, so I'm going to give you another example. You tell me what this is. Hopefully everyone remembers drawing the arrow. Doesn't want to run. Look there.
Okay. Okay. Acidosis. Okay, so that is respiratory
What
acidosis.
is it?
Respiratory acidosis.
What is it?
RA.
So half of the answer, we already know we're only gonna pick what? We're only
Acidosis.
gonna pick what?
Acidosis.
Acidosis. So we're not gonna pick any what? Any alkalosis. All the alkalosis are what?
Wrong.
Eliminated, right? So we only have two options left. Who says it's metabolic? Who says it's respiratory? Alright, there's a few. A few did it. Raise their hand. So, what do you do? Draw
Arrows.
arrows. Up or down?
Down.
Up or down?
Up.
Do we have opposite arrows?
Equal.
Do we have opposite arrows?
Yes.
We do. One is up, one is down, one is up.
Up.
So it's automatic what?
Respiratory.
Right? So it's automatic respiratory. Is that clear? Yeah. Yes. You already know? Does everyone know already how to break it down? Right? Or anyone else still wants to ask? Another example? Another example?
Yes.
Alright, so here's another example. Go ahead and do it.
Respiratory.
Alright, another example. Here we go, another example.
Okay. Acidosis. Respiratory is wait, no. It says wait, what is that? 2? Metabolic acidosis. That sounds way too low. How do you get a 2?
So, what's half of the answer?
Acidosis.
Acidosis. We're not gonna pick any one. We're not gonna pick any alkalosis because the pH already tells you you're supposed to not pick any
Metabolic
alkalosis.
acidosis.
Acidosis,
Yeah.
right? Then the next step, what do you do?
Arrows.
Arrow. Arrow, up or down?
Down.
Up or down?
Down.
Up or down?
Down. Metabolic acidosis.
And all of them are pointing at the same direction. Metabolic
Acidosis.
acidosis. There you go. Now you're all experts, right? It's easy now. All of the other interpretations, don't worry, you'll do it when you go to your RN program, especially like compensation. But for the meantime, for the LVN, you don't really have to worry about compensatory ABGs, okay? No, for your RN English, yes, it will.
Don't worry about that then.
Okay, but for the meantime, this will at least help you already with our exit and the NCLEX. Now, this is one version of it. It's one version of it. The other version is, which makes it harder, is that they will give you. This is what they'll do. They'll give you the condition. And then they'll ask you what would be the expected lab values. What will be the expected lab value? So,
Okay, so
We all know that
Low
what type
pH.
of lab value are you gonna go for when it comes to pH?
Low.
Something that is what?
low.
Higher than
Wait, no, alcohol.
7.45. So we can eliminate all of the option that is
Got
what?
a CO2
Lower
sugar.
than
7.4.
7.35. So I'm gonna give you two, and you tell me which one you're gonna pick, okay? Give you two.
CO2 is low.
This is the pH.
Okay. B. That needs to be opposite. Broncholosis.
Wait, give me 1 minute. Just gonna erase something.
Before medical.
I'm gonna erase this one. I'm gonna add the one that is more significant.
The CO2. Yeah, there you go. CO2 needs to be low. Okay, it's A. It's probably A with compensation.
Sorry, this one.
What number is it? Oh, 30. Okay, then it's
This
B.
one is 30. There you go. Which one is the right answer?
B.
The answer is
B.
letter
B.
B. Okay, so why? So this one is
High.
up or down?
Up.
Up or down?
Up and equal.
So meaning that we only have one arrow.
Yeah.
Up or down?
Up.
Up or down?
Down.
Meaning we have
Opposites.
opposite arrows. So what's the answer?
Respiratory.
Respiratory.
Alkalosis.
Is that clear, guys?
Yes.
Right there. So if you're looking for respiratory, even though they give you the value that's only 2, look for the option that will give you what? Opposite arrow. Now if it's metabolic, look for the value that will give you what?
Equal.
Arrow of the same
Direction.
Okay, so let's do another example. So let's say they gave you the diagnosis is so we all know we're gonna look for a pH that's what? Less than 7.35. So I'm gonna give you 2 options then. We have 7.2, we have 7.1, right?
So it needs to be equal. Okay, so bicarbonate. No.
HCO.
B.
What's the answer?
B.
The third?
B.
Does everyone know that it's B?
Yes.
Want to make sure because some of you are just looking at it and like, alright, so what do we do?
Arrows.
Arrows.
They're both going
what
down.
arrow? Up
Down.
or down? Down. Up or down?
Up.
Up. So that would be what?
Wrong.
That would be wrong. That would be what?
Respiratory.
Because we have opposite arrows, right?
Yeah.
Arrow, up or down?
Down.
Arrow, up or down?
Down.
The same direction. So that is
Metabolic.
The answer is E. So do the same technique. Okay? Is that clear already? Yes? Alright. So last thing that they're gonna do is they might give you the actual diagnosis. So I'm gonna give you examples of diagnosis because what they might do is, it's a little bit harder because this sample, let's say for example, they'll give you that the patient has
Renal failure.
But they're gonna ask you, based on the patient's
Metabolic.
diagnosis of renal failure, what would be the expected ABG? Guess what? This one actually, if you think about it, is easier because as long as the diagnosis is not related to the lungs,
It's
you
metabolic.
already know it's what?
Metabolic.
Metabolic. And if it's related to the lungs, it's what? Respiratory.
respiratory.
And all you need to do is look at the what?
Values. pH.
Just look at the pH. Okay? Is that clear, guys?
Yes.
Is that clear? So I'll give you an example. Okay? So
Okay.
before we answer that, what kind of condition is renal failure? It's actually what? Acidosis. So I'll give you
Metabolic
examples of what is acidosis and alkalosis. So for renal failure, this is actually metabolic
Acidosis.
acidosis. Right? So don't forget that. Renal failure is what? Metabolic acidosis. So by just knowing that, what kind of value do we look for? Arrows that are pointing at the same direction. Look for arrows pointing at the same
Metabolic.
direction. Right?
They're both down. No. It's gotta be B. B.
So which one is renal failure?
B.
Letter B. This one, the arrow is down. This one, the arrow is up. That's respiratory. This one, the arrow is down. This one, the arrow is down. That's metabolic. Metabolic acidosis. Renal failure. Are we clear with that one?
Yes.
All right. So what are examples? Here we go. What are examples of? Let's start with respiratory. Examples of respiratory failure. Write this down, okay? Don't forget. COPD. It's a respiratory failure. It's another example. Respiratory failure is another example of respiratory acidosis. Okay, so respiratory acidosis, COPD, respiratory failure. Okay. Now, I just want to make sure this is clear with everyone. There's actually two types of COPD. So I want to make sure you know that that's a COPD. What are the two types of COPD? Emphysema and chronic bronchitis. So don't forget, if that diagnosis comes up, that's a COPD. There's two types, emphysema and chronic bronchitis. If both of them comes up, you know it's what? Respiratory acidosis. Okay, that's a COPD. Other than that, respiratory failure. Okay, it's another one. Asthma is another one. They're having an asthma attack. That's also respiratory failure. Okay, or respiratory acidosis. And sorry. What else is respiratory acidosis? Bradypnea. What does bradypnea mean?
Slow respirations.
Bradypnea. Slow respiration. Very good. Slow respiration is also a respiratory acidosis. Okay. Are we clear with those examples?
Yeah.
Right. So, what are examples of respiratory alkalosis? Hyperventilation, right? Hyperventilation is an example. Tachypnea or rapid respiration is another example. Okay, so hyperventilation, tachypnea, okay? Oxygen toxicity is another example of respiratory alkalosis. Okay, that's another example of respiratory alkalosis. Again, hyperventilation, tachypnea, oxygen toxicity. Okay. All right, next. Metabolic, right? Metabolic acidosis. What are examples of metabolic acidosis? So we
Diarrhea.
have renal failure,
I know.
DKA or diabetic keto acidosis. Okay.
DKA.
So again, renal failure,
DKA.
DKA or diabetic ketoacidosis. The other one is diarrhea, right? Acidosis, don't forget. I think that's very easy to remember, right?
Diarrhea.
Acidosis, diarrhea. Okay. Right? And the other one is liver cirrhosis.
Liver cirrhosis.
It's another example. Aspirin toxicity is another one. Okay, overdose on aspirin.
Aspirin toxicity.
Another example. So don't forget, liver cirrhosis also means liver failure. Okay, so they're the same. Okay. All right. So what are examples of metabolic alkalosis? Not vomiting, right? You're losing a lot of gastric acid. Okay. Toxicity to antacids. Okay. If you overdose on antacid, your Tums, you just wanted to eat Tums and you ate a whole bottle of Tums. Metabolic alkalosis. Okay. Another one is excessive diuresis. You urinate too much. That's also metabolic alkalosis. Another example, because this comes out of your exit, is NGT suctioning.
Oh
When
yeah.
they suction the patient, the stomach, because it's removing gastric acid, that's
Okay.
also an example of metabolic alkalosis. NGT suction. Okay. Alright, are we clear with that one, guys?
Mhm.
Alright, so we're gonna go and do our exam. Who wants to go restroom first?
Restroom.
Example earlier when we were discussing about